Life.
It says waiting for it. I don't know, but I don't know, something happened to my screen where it sort of froze.
No, I think we're ready. Hello,
I just
everybody.
hope we can see each other
Can you
so
see
we
each
know
other
when we're
now?
talking.
Can you guys see each other yet?
No.
No.
Okay, well, I'll let Benjamin
No.
know that. But right now it looks like we're live. So thank you, everybody. For your patience. We are trying out a new program right now to be able to set up a live stream ahead of time so that we don't have to just always pop up live spontaneously. And we are working with Benjamin. They are not able to see each other in their dialogues on their screens.
I see you, and I see
Uh-huh.
myself in a thumbnail.
Okay.
That's exactly same here.
Same there. Okay, so this is our trial and error right now.
You
So
started the show?
I did, yeah. So we're up and we're working out the kinks live. So
I don't know if people can see me dancing
Yep,
while they wait.
we can see people can see all four of us in the screen.
Oh.
It looks really nice. I can see it on YouTube, but it's somehow you guys can't see each other. So that's the problem.
Oh.
So we'll just get started and chat about the topic at hand while we fix this bug, because this bug is more on our end than on the viewer's end. So today is Monday, May 6th. We're joined by Pamela Garfield-Jaeger, our friend, and I'm Leslie Elliott Boyce. We have Deborah Knox, Jennifer Friend, our usual suspects, and Pam, who joins us sometimes. So the topic we wanted to discuss today was something that came up while we were talking with Pamela last time we had you on. And it was overprescription and psych meds in general. What are we doing with them? Are we overprescribing psych meds? As a culture, are people taking too many? Is this a quick fix that people are going to before they could go to other interventions or try other things? So all things psych meds. And I am really excited to dive in and hear what you think about this topic, Pamela, because I know it's something that you've had some experience with and have done some research on. And Deborah, would you like to start us off with the description of what we are, who Solid Ground is?
Sure. Excuse me. Solid Ground is a peer support community for anyone concerned about the imposition of critical social justice, aka woke, and/or COVID mandates in their workplace, university, children's school, or community. We offer weekly online peer support groups in which members share ideas, thoughts, and support for how to navigate the impact of these ideologies and answer the question, where do we go from here? You can join one of our groups for only $5 per month. To find out how to join our community, please visit solidgroundsupport.com. And please note that Solid Ground does not provide psychotherapy or legal advice, and nothing we do should be construed as such.
Excellent. Thank you so much, Deborah. And so I know it's kind of weird right now because you guys still can't see each other, but you will in just a second. So Pamela, would you like to sort of start us off with this topic? Oh, you can see each other now. Okay.
Yes.
Thank you, Benjamin.
Hello.
Hi, guys.
Awesome.
Yay.
All right. So now that we can see each other, and thank you so much, Ninja Kitty's in the chat. I always love your participation in these. So, Pamela, psych meds. What's your experience with this?
Oh my gosh.
What are your kind of get us started on this topic?
Yeah, so I've been a therapist for over 20 years, and I got to be honest, I didn't put as much thought into it while I was practicing. And of course, since I've been out of the field, I was knocked out because of my own disability, and then because of the COVID mandates, and because of all the woke. I've done a lot of reflecting. And one of the main topics I've thought about is psychotropic meds, and especially how they're being used with youth, minors. And I have really thought about how they are overprescribed, not just overprescribed, but just wrongfully prescribed. And reflecting on my own experience working in PHP, IOP programs with mostly adults, some teens with mental illness, a lot of people who are on meds, thinking about how they were prescribed and how I was quite passive at the time. thinking the doctors knew best because I was one of those people, like most people. Doctors know I don't have a medical degree and I will defer to what they have to say. And now, in hindsight, I'm realizing I knew it at the time, but I'm realizing more solid ground, that they didn't know what the heck they were doing. It was all a guessing game. And of course, I can't say whether they'd be better or worse without the meds, but I certainly have a lot of questions and a lot of thoughts about it.
Well, I worked in primary care clinics for about 11 or 12 years, two different clinics, each for about 6 years. And one of the things that I saw a lot in the first clinic that I worked in was pharmaceutical reps coming in.
Oh.
And the education that the doctor would get on a new drug was a lunch with a pharma rep. That was how they would. The doctor at that clinic, there was one doctor and a nurse practitioner when I worked there, and I worked there for, again, 5 or 6 years. It was a primary care place that mostly saw geriatric patients, but saw people of all ages. And we would have a different pharma rep trying to bring lunch every single day.
Wow.
The doctor wouldn't always accept it, but would often accept it because lunch would be provided for the entire staff. So it would be this big catering thing. And so that's how we got lunch many days, was from these
Wow.
pharmaceutical reps. So they would come in and they would bring food and sometimes little treats, like they would have, like, koozies and pens and, all the stuff. Swag. And magnets and clips and all kinds of little things that would be branded with whatever the new drug was that they were trying to sell. And the doctor, one of the things that I commonly heard was the doctor doesn't have time to read. They don't read these medical journals. The journals just kind of stack up. The doctor's booked out all day, every day, and then on the weekends just wants to go be with family or do relaxing things in the evenings. So that the only time that they would have to learn about new drugs would be during that lunch, which the trade-off for bringing that big lunch was getting a half hour to an hour of undivided attention from the doctor while the doctor scarfs down that meal, going over charts at the same time, going over patient charts, looking at his afternoon, scarfing down his food, two pharma reps sitting there talking about the drug. And so these doctors were prescribing everything. They were psychopharmacology was on the menu. So was Vioxx for a while. Vioxx was there. Like all these drugs, there were from any class of drugs that a primary care physician could prescribe was being prescribed. And so at the end of the day, that doctor was only about as educated on that drug as a patient would be if they'd watched pharma commercials.
Mm-hmm.
And so we have this culture of also patients who have some exposure to information about different medications and come in asking for what they want. Mm-hmm. And so what you're saying about the doctors not necessarily being that educated about what they're prescribing, that resonates for me. Although I don't know what it's like for psychiatrists and people who specifically prescribe mental health medications.
I would say even if they are educated, they don't know how it's going to impact that individual. It's very different per person, depending on their bodies and their brains. And of course, all of this is unknown. Is their brain chemistry or any of that stuff even real? I don't even know. But I watched a lot of patients over several years respond differently to different medications. They would change the dose. They would change the time of day. It was all a guessing game. And oftentimes they did land in a place that was somewhat more functional, but the whole thing was a guessing game. And I don't think people realize how much it's really just throwing spaghetti at the wall about, we just don't know. And then I'll just share, I have a personal experience. I was put on antidepressants because I had this serious pain condition. I'd never been on antidepressants before. I went through a whole bunch of different antidepressants because I had a lot of side effects. I landed on Celexa, did nothing for me, of course. I wasn't depressed and it didn't touch my pain. It did nothing for me. However, I couldn't get off of it. I was on it for about 2 years and I couldn't taper off of it because whenever I got to this low level, I started to just uncontrollably cry all the time for
Oh,
no
wow.
reason. And it made me crazy. And the way I got off of it was taking liquid form. I had to do it in drops over like an 8-month period. Like
Wow.
every couple of weeks, I would just take one less drop. That's how hard it was for me to taper off of that. And that gave me a whole new respect for how hard it is to get off of these meds. And it's no joke. I was not told that. I was not given any of that
Of course
informed
not.
consent. Yeah, I was just prescribed by a primary care physician. And then, of course, it looks like on my chart that I'm a depressed and anxious person, which I never had those evaluations or diagnoses. But then every doctor just assumed that my pain was a result of my mental status as opposed to the fact that my bones were crushing my nerves.
Oof.
Oh,
So yeah, I have a whole new view on it now. And I'm watching kids being prescribed it really young who they don't even try other things. They're just given meds. They're wrongly diagnosed or overdiagnosed. And I think it's a real concern.
And this is when those developmental pathways are being put in place. I mean, you're reminding me, and I wish I'd prepared this for our conversation today. I remember like 30 years ago reading this book, The Anatomy of an Epidemic, and it was on this very thing about psychiatric meds, and it was on the salespeople doing what they were doing, the off-label, oh, let's just use this thing for something else type of thing. Because I had a lot of people in my life kind of really pushing meds, and I was very resistant to that. And, in my mind, I don't really know. I had the sense that, the brain is so complex, and it's like maybe they address something on the first order of what's on the surface, but then there's so many interconnections and other things that and you might get temporary relief, but then you don't, and you have the side effects and all of this. And I just think, I'm not a scientist, but I feel like our whole systems are so much more complex, and having some simple chemical address the entire thing. And then when you're talking about these side effects that no one told you would have, that it puts you in worse state than you even started. I mean, it just seems like malpractice.
It does. I have a lot of anger. And I'm okay now, but I went through a lot. So I just think about other people who have much worse effects. One of the big ones, something everyone's talking about all the time, is sex drive and sexual desire. I took a training. I wish I remember the full title, but it was something about people with vulvas and their sexual dysfunction by CAMP, California Association of Marriage and Family Therapists. I'll have to look it up after. But it did give a nod to antidepressants and how they can give permanent sexual dysfunction.
mm-hmm.
And I don't know how many patients are told that when they're given these antidepressants. And then they decide that they have a gender as their gender and they get a flag as opposed to being a functional human being.
Yeah, I took an SSRI for about a year when I was in my 20s. And when I decided I wanted to get off of it, I had really intense withdrawal symptoms. And I was just taking whatever the normal, probably lowish dose was, because I'm always really sensitive to medications, so I tend to be on a lower dose. And I had what they call brain zaps.
I've heard about that.
Yeah.
Mm-hmm.
I had them for quite a while, and it was really awful. I was very motivated to get off of the medication, but if I hadn't been, I would have gone back on it just to stop that experience from happening, because it was really uncomfortable.
Yeah, it sounds awful. I've heard about it.
Mm-hmm. And then benzos, anybody going through that withdrawal. I remember talking to a young man a couple of years ago, and his nervous system was just a complete wreck for years. And you've seen whatever with Jordan Peterson dealing with that. It's, ugh.
Mm-hmm. Yeah, it's. I actually just listened to a podcast. If I can find it again, I will let you guys know what it was. But it was with a doctor who is a prescriber. He described himself as both a prescriber of psychopharmacological medications and a critic of the use of these medications. So he's someone who tends to prescribe really selectively and carefully. And he talked about the sexual side effects of antidepressant medications being almost a bigger effect than the antidepressant effect. The SSRIs are mostly they mostly have an anti-anxiety effect. Mm-hmm. And then their second largest effect, I believe, is the sexual side effects. So that was really interesting. If I can find that, I'll link it or mention it in this episode.
Yeah, so I just read this.
Go ahead.
I was going to
Go
say,
ahead, Pam.
I just read this article by Abigail Schreier. You guys are familiar with her. She just came out with this book. I haven't read it yet, but I really like the topic, called Bad Therapy. And I've listened to her speak on it. And the article talks about the connection between the detransitioners that she met. She quoted Chloe Cole, and how they were given medications when they were really young. They were misdiagnosed with ADHD or other mental health things that weren't even true. And then they became more dissociated from their bodies as a result, which was one factor, I'll say, to their belief that they were born in the wrong body. So it's not a coincidence that a lot of people who identify as trans are on some kind of medication. Of course, a lot of them have mental health issues, but also, it's hard, which comes first, the chicken or the egg, but I mean, it's a cycle. And I think it's all related. I think it's all connected. And it's just another thing to sort of keep us sick and disconnected.
Let's see. Jen in the chat says, "Hi all, happy to be hanging out."
Oh, we
with
can see
you."
it.
Yeah, you can add them to the
I
screen
see
now.
it.
That's pretty cool. Therapist here, so extra interested. Thanks, Jen. And then let's see. I wanted to read a couple more of these. Oh, AD says he or she was on Haldol for years. Wow.
Oh,
That's an
I
old
wonder.
school one.
Yeah, I wonder, did you get tardive dyskinesia from it? The involuntary movement
Yeah, let us know, AD.
disorder. That's a really, really bad side effect that can be permanent for people.
And then they have medications for that. So that's the other thing. You get that,
Right.
the TD, and then you get the medication to address
Right.
that.
Right.
There's this old Bert and Ernie cartoon where Ernie tells Bert to stop this noise, the dripping of water, and I don't want to hear it anymore. So then Ernie gets up and turns on the vacuum cleaner. That's what I feel like this is. What are brain zaps? Someone asked.
Running Bear wants to know what brain zaps are, and then someone else answered it really well. So Dan says, like an electric shock in your brain and nervous system. Yeah. Yep, that's what it was like.
And
it's like a jolt. It felt like biting down on metal. Like,
Ugh.
yeah, it was like
awful.
this really intense just jolt, and your teeth would come together, and it felt like if you've ever like put a key or a coin in your mouth, like that metallic. It was that's what it was like. Good Grief says makes you dizzy and nauseous and confused. Yeah.
I'm curious, Leslie, when you had that, I'm imagining you maybe said this to your practitioner. Did they go, sorry? I mean, what did they say?
It's very common too.
I don't know if I did say it to. It was a nurse practitioner who prescribed it to me. I worked at the clinic, and when I was going through a really hard time that I felt like I needed help with, I said maybe I need an antidepressant, and so she just prescribed me one. I don't know if I ever spoke to her about my negative experiences, or if I just kind of looked up what those experiences would be online. So I don't know how many doctors hear the feedback from their patients, negative feedback about withdrawal. I certainly don't know if I mentioned it to her. and at the time I really subscribed to the like, what is it called? The deficiency theory of neurotransmitters, like that this is actually a deficiency that you're experiencing, and so these things are going to help you balance your system. I believed that at the time. That's what we were told, and I believed it. And now I know
Yeah.
that that's not the case.
Yeah, it's interesting. I've read a number of articles lately saying the whole theory about the brain chemistry being out of whack, which we were all taught and believed for years and said to our clients that that's essentially been debunked, and that now they're saying, well, basically, antidepressants do have some positive effect, but they don't understand why, because the whole theory about the brain chemistry has been largely debunked. But then also I've read that long-term use of antidepressants is basically the same as a placebo. So I mean, to me, that really suggests that for how these are used should change. That, yeah, maybe for some people in, a short term, really stressful situation, it can be helpful, but that the goal would be to get off relatively quickly and to build your coping skills and your support network while you're on those meds, and then have assistance from your prescriber in titrating off of them correctly. That's what I'm guessing from what I've been reading. I'd be interested to hear what some psychiatrists say, um, now that this information is out there.
I wonder how
I
much
know
how many they know, how much they know about it. Sorry, go ahead.
Yeah, yeah.
I do know that there are some practitioners who are starting. I have a friend who was doing this. They're starting to do, I know two people, some sort of genetic testing, and then there's some probability that a particular thing will work for you or not. I don't frankly know if that's been borne out, but you can pay for these expensive tests to determine what would be something that might work better or not. But I don't know, in fact, if that ends up, being the case.
Yeah, they numb you out. I'm looking at this comment that the SSRIs make you less empathetic, which you can see how that could really create problems in relationships and connections among people, which underneath it all is one of the biggest problems in our culture, is that we're not connecting the way we used to for lots of reasons. Technology is one, but medications are another.
Yeah, I will say though, on the other hand, if you're sort of swimming in empathy, and every single thing that you hear about something going on in somebody else's life makes you burst into tears and feel like crawling under your bed because you're overwhelmed with the cruelty of life, then feeling less empathy can
Yeah.
actually be a good thing. It's sort of a matter of degree, I think.
I guess I just rather that be without chemicals. I have to figure out how to do that without chemicals.
Yeah.
Because from what you're saying, I would argue when there's a crisis or an intense situation, that would be the time to not use the medication, because then it's clearly circumstances or something short term. If someone's had really, because I've met people like this working in residential programs who are really chronically depressed, and they've really tried every treatment, and they've exhausted everything. And of course, they've been on antidepressants, usually don't respond. However, I wouldn't blame them, or I wouldn't blame doctors for wanting to try new different medications for someone who's had this chronic depression, that there isn't an obvious external reason for it. Mental health is quite complex. Is it organic? Is it circumstances? Is it trauma? Is it temperament? Is it right? Who knows? I'm not even going to get into all of that. But I don't blame people for wanting to think about doing something if it's a really chronic scenario. However, if you're going through some serious grief or something really terrible happened, running to medication right away, I don't believe is the answer.
Yeah.
I feel like people need to feel pain. That's we need to feel pain. It's interesting. We feel like if someone is hurting, we need to fix it. And sometimes we need to feel pain.
Yeah, you sent me a link yesterday, Pam, and it was a video from a man who had retired from being a therapist, and he gave several reasons why. And then I followed that video. Do you remember the name of that gentleman? Daniel something.
I don't, but I can look at it real quick. Let me look at it because I have the text that I
Okay.
sent you.
Yeah, it was a good video. I thought it was interesting. He brought up some things that seemed that were similar to the reasons why I'm fine not
Yeah.
becoming a licensed therapist. But
Daniel Mackler,
Mac,
Mackler.
he had another video that I thought was that I watched part of that was about psychedelics and why he doesn't recommend using psychedelics to heal childhood trauma was the specific name of that video. I listened to part of it, and one of his main reasons was even if it is helpful for you, you lose the opportunity to work through something in a way that leads to a sense of having overcome something yourself.
Interesting.
And so that kind of relates to the I think the argument you were just making about recovering through learning your own methods of self-improvement or not through some drug. And I have to wonder how much of the positive effects people feel from psychopharmacological drugs are placebo effect. I had the experience recently of a young client of mine deciding to start taking an SSRI through her doctor. And she felt so much better right away, just instantly. It was so much better. And I thought, I wonder how much of this is just a bounce in her own expectation and her own sense of efficacy because of it, and how much of it is related to the medication.
Yeah, it's supposed to take about 3 weeks.
Yeah.
You're saying the same thing.
Right. And how much of it is that you've made a decision to sort of take a positive step and take control of your life? And is that yielding some boost in mood? The thing is, I don't know what you guys think of this, but what about a situation where, yeah, it's situational and like somebody's spouse leaves them, their mother dies, something else goes wrong, and all of a sudden they can't sleep at night. They're really depressed. They're super, super anxious. I can see the value of just, working through that without any chemical assistance. However, most of us have jobs and have to function. And what if you just can't anymore? What if you're bursting into tears at work and you're having panic attacks and you can't do a presentation anymore at work? To me, it's like it would be great if we lived in this society that was super, super conscientious and had sort of built-in planned sabbaticals for crises or even for spiritual or personal growth. But we don't. And so what the hell do? Like, you have to keep functioning. And sometimes the only way to do that is to, drug yourself for a little while. Better living through chemistry to get you over that hump until you've regained your functioning level.
Yeah, I'm thinking if it's informed consent, right? If it's, I remember a person when I used to live in Boulder, he was a holistic psychiatrist, and he was one of these that meds barely, but super small dose, super judicially, short period of time, understanding the hazards, making those clear. And that seems like responsible. It's sort of like addressing what you're talking about, Jen. Sometimes one might need a buffering or something, like there's just too much for the system to do at once that allows for something like that, while well noting there are trade-offs. There are, just going into something like that in an informed way. Although interestingly, this particular psychotherapist or psychiatrist is now all on ketamine. So they moved the entire practice, and now it's like a total ketamine practice. So I don't know whether that's judicious or not, but
I cannot even imagine after my experience.
I know
with
your
ketamine.
experience. I almost didn't want to say the K word, Leslie, because I know about that.
I need a trigger warning for ketamine. Just kidding. Just kidding. Chris Rage says, I've tried antidepressants and they made me feel awful, like physically hollow inside. I'm super happy I never took them steadily. And if you read the insert, they don't even know how they work. And that's so when I was in undergrad, I know I've told you this before, but I had this I had taken a bunch of courses and then transferred, and a lot of my courses didn't transfer to the university that I transferred to. And my faculty advisor was the chair of the psych department. So she took pity on me and offered me the chance to take some of these classes with the clinical psychology master's program for undergraduate credit, because she knew I would be just retreading the same water. And so it might be more interesting to me to take it a level up for undergrad credit. And so I took this neuropsychology course, and there was a lot on psychopharmacology. And one of the things that really was drilled home in this course was we actually don't really know what we're doing with these drugs. We really don't know. We try them out for this and that. The effect sizes are there, but they're kind of small. They kind of come out over the aggregate, but we don't really know what we're doing when we use a lot of these drugs in people. And they cause so many side effects that we call them side effects as if they're, maybe this could happen, but they're as big an effect as the main effects.
They're the effects.
They're the effects. Yeah. And a lot of times the drugs that we use to manipulate people's mental health were not developed for that in the first place at all. They were developed for something entirely different. And then it was noticed that they had these effects on people's mental states. And so we start using them that way. So that's interesting, Chris. Thank you for sharing that.
I'm really interested also about the kids, the youth. I don't want to get too much into it because it's somewhat personal, but I know a mom that gives her daughter ADHD medication preemptively and just gives a lot of medication to her own daughter. She's a doctor herself, so she's giving medications to her own daughter, who I know the daughter and doesn't have ADHD symptoms, at least not in circumstances when she wants to pay attention. So I look at people believe they're giving someone medicine almost like they're giving them vitamins, or not realizing that it has all these risks. We're almost playing God with it. And when we're talking about developing kids who don't have a frame of reference, who can't tell you, I feel foggy, or I don't feel a sex drive. A 12-year-old or a 13-year-old usually can't articulate those sorts of things. They don't have a frame of reference to say that they're not feeling themselves, because they don't know what themselves is yet, because they're a child. Mm-hmm. And we're throwing meds at all of these kids, especially adolescents, and we know they also many have the adverse effect, meaning the antidepressants are known to cause suicidality in teenagers. They don't know what they're doing. Those things, no one knows for anybody, but they were not made for teens, and they're now being widely used for teens. It used to just be like only in those extreme scenarios. And everything seems to happen that way. Oh, we're just going to do it for these certain situations. And then it becomes more and more widespread. And now it's become normal that teenagers are on antidepressants, teenagers are on benzos, teenagers are on ADHD medication, and they're diagnosed with all these things, and they never really address what's happening and learn how to cope and learn how to have resilience.
Yeah, I wanted to read these comments here by Chris Rage. I think I put this on earlier.
Yeah.
Xanax is a really awful drug to try to get off of. I quit 6 milligrams a day, cold turkey, and it was 3 weeks of hell.
Wow, 6 milligrams a day. It's a lot.
Is it?
Yeah.
I don't know for Xanax. Is that a lot? Yeah? Okay. So then Chris says, I felt like all the fat in my body was melting out of my pores. I was having mild seizures and I couldn't sleep. I had the worst nightmares of my life, but couldn't remember them when I woke up.
Wow.
I would wake up screaming, but I couldn't remember why. I was highly anxious. It felt like it would never stop. And brain zaps are like a lightning bolt between your ears or in the front of your forehead. Yeah. Well, thank you for sharing that.
Sounds nightmarish.
Chris. It does sound nightmarish.
Wow.
I don't know about benzos. I've always felt like that was something I knew was a really scary medication just from the little training that I did get, that they're highly addictive and they they're very hard to get off of. And I don't know a lot about that. So thank you for sharing that
They
perspective.
are great for certain circumstances. Like let's say you're going to have a surgical procedure, like a procedure, but it's a procedure where you're going to be awake, and you're feeling highly anxious about it. If you take a benzo beforehand, you will feel much less anxious, and the pain level is dramatically decreased. It makes a huge, huge difference. So I think they're wonderful for things like that. They're
Yeah, one time in
wonderful.
moderation, it's okay, I think.
Yeah, yeah, they're great. PRN for people who do not have a history of
Exactly.
addiction. They are incredibly effective. If you're a person who has a public speaking phobia and you've done everything you can to address that and you just can't, it will dramatically help with that for a lot of people. So they, I think, I do not want to throw out the baby with the bathwater. I think
Hmm.
I actually am pro benzo, but used really, really wisely.
I've also known people with schizophrenia, bipolar type 1, and they wouldn't be able to function without their meds. I believe that it's
Yeah.
needed. It's one of those necessary evils. It's that risk cost benefit,
Mhm.
right? Or what is it? Cost risk benefit. I
Cost
don't have the
benefit
words.
analysis.
Thank you. So you have to look at that. So if someone has a manic episode and ends up streaking or doing illegal activities or doing really dangerous things, I've known people have had this.
Oh,
They,
yeah.
they need a mood stabilizer to curb those behaviors, but then they'll have more stunted affect and then they'll have other side effects. So it's a tricky thing to figure out what is best for that person. When I worked at the clinic, this was in 2008, 2009, people were more monitored. Insurance wasn't shoving them out the door in a week. So there was time to figure out what is the right concoction for certain people. Um, so I don't want to throw the baby out with the bathwater either. I actually have seen people who have really benefited from medications. I think it's just gotten so broadened that people that don't need it, or it's now the first place to go, first thing to run to, as opposed to trying other things.
Well, that relates to the comment that I just put on the screen. I'll put it back up. PA62 guy says, my son had what amounts to a nervous breakdown in ninth grade. The meds were very helpful in his case. We weaned him off in 11th grade. So there's a positive
Yeah.
experience.
Yeah.
And
There's a successful use of meds, and I like that they didn't just make the assumption, well, you've had this one experience, so now, therefore, you have to be on meds for life.
right.
Um, and that they weaned him off. I think it sounds
It's
like
a
they handled it really
short-term
effectively.
experience. Yeah.
Hmm.
If I can make these a little smaller.
It's
Yep.
ridiculous. They're literally giving it out like candy,
Free
as
samples?
Good
Oh my
Grief is
Yeah.
God.
saying.
This is how
Unprescribed.
yeah. Yeah. Good Grief says, I got free
Oh,
samples of
wow.
SSRI from the Student Health Center at my college because I said I felt depressed about a breakup. And this is something
Huh.
also, those drug reps that come in and treat the doctor to lunch, they bring tons of free samples too. And so a lot of the medication, like we had a sample cabinet. It was a huge cabinet full of samples, and it was stocked according to medication. And so, as somebody who worked at a clinic, I could just access the free samples, and so that's how I would take medication, was to just get samples. I would get the doctor to put it in my chart, and I would do it. Good Grief also says, and to be honest, they did make me feel super happy for a while. But I didn't realize I should have grieved that relationship instead of masking it.
Yeah.
Yeah. Yeah. Let's see. There were some other chats that I wanted to. Patty P. Hi, Patty says, yeah, some things in life are sad like death. Doesn't mean meds are appropriate. And I don't know if I put this one up already. Good Grief says, I was on SSRIs and then also anti-anxiety meds for 25 plus years and finally realized I had wrecked a lot of my life not dealing with
Wow.
things.
Yeah.
Mm.
Right.
That's,
So
yeah.
it's when you're using them to avoid things. So the way I always saw it, the idealistic way as a therapist, is when someone is so depressed they can't handle things anymore, so they no longer are able to engage in therapy or no longer able to address things and work through things.
Yeah.
So the antidepressants or whatever medication is there to help them so that they can process their feelings, because then they can get up and take a shower and get to their session or get to the program they need to get to, or
Yeah.
enough to be able to work through things. That's the way I saw it, but it's not being used that way. So you have in your head how you think it should be used, and then there's real life.
Yeah.
Right, right. No, I agree. I always saw it as this is sort of like the meds are just the vehicle that kind of helps you to get where you need to go, but you're still the driver. You still have to drive the vehicle. You still need to do all of those things for yourself that you need to do. Maybe you need to go to therapy, change your lifestyle, whatever it is. Maybe make some changes in your life. Maybe you need um, a different workplace or that kind of thing. But yeah, I
And there's
think
no
it is
follow up.
sort of
A lot
yeah.
of very no it used to be, if you were given psychotropic meds, you were seen by psychiatrists, and there was a requirement to see them usually once a week initially, and then maybe once a month, and you'd be tracked and monitored because things shift and change over time. But that's not happening anymore. It's being prescribed by primary care doctors. There's no monitoring. And so that's the other thing that people need to realize. It's just not how it used to be.
No, and not even
Yeah,
checking,
yeah.
like some meds would affect your kidneys or your liver, like if you're not having blood tests for those sorts of things. That just,
Right.
seems really negligent.
Thank you for the
Hmm.
super chat, Fandar Zelig. I think that's how I'm going to try pronouncing your name. Enjoying the discussion. Cheers. Thank you so much. And yeah, Chris Rage. I don't know if Chris is a man or a woman. I'm picturing a man, but I could be wrong. Says it wasn't a smart choice. This is in reference to stopping the 6 milligram
Cold turkey.
Xanax. I should have tapered, but I didn't want to be on it anymore. The first day wasn't bad, but day 2 is when hell kicked in.
Mm.
Yeah.
And the other
Maybe-
thing, oh, go ahead.
Go ahead.
I was just thinking about the whole boom in Zoom therapy and remote therapy. And there's a whole thing now with AI therapy. And how are we going to be monitored when people are just on a computer screen? And yeah, so that's just a whole other thing that just came to mind. I feel like people need to be seen in person. They need the blood test. They need to be evaluated, and these things are being skipped over.
No, I was just wondering, but we don't know, like, what are psychiatrists in training being taught, like in med school, people doing that specialty? Are they talking about this? It's like, I have
Yeah.
no idea.
I doubt it. Probably on a minimal scale.
Oh, thanks, Ninja Kitty. It says my mic is a little bit low compared with the others. Thank you. Maybe I'll just sit closer to it. They're probably closer to their microphones.
I have a little.
Okay. Yeah, I have mine way over here. So let's see. I wanted to read another one of these. Here's one. PA62 guy. I agree with Pamela in general, but serious situations can arise where short-term meds can calm a situation that is veering out of control, but yes, they're overprescribed. So that's echoing some of the points made by Jennifer
I agree.
about the utility of medications sometimes. The Clue Channel, thank you so much. A super chat. So much good information in every show. Thank you. That's really nice of you. Thank you.
And I think I just wanted to comment it because it relates to the trans issue too. And again, I want to make a distinction between someone who's having like some seriously acute matter or is, manic depressive or like something like that. But this notion of whether the trans kid's like, oh no, they don't feel good, we have to affirm, to oh no, they don't feel good, we have to give them a pill. This notion that like either yes, puberty is difficult, yes, life is challenging, yes, things feel bad, and the way we've sort of strayed from helping kids. Well, one, just saying, yeah, that is how things are. right? And how can we help you have the capacities to navigate that? And instead there's like, throw the, again, with these situations that aren't grave, just throw the pill at it because you shouldn't be uncomfortable or something.
It's like another form of affirmation therapy in a way, right? Because I think it has a lot to do with the therapist or the adults or the caretakers feeling uncomfortable with the pain that the patient is experiencing, and they want to fix it as easy and quickly as possible. And I think that's a lot to do with our culture. And parents don't want to see their kids in pain. They want to see it, they want to know they're helping. And medicine, just the sound of it, medicine helps. Usually, we think it does.
It heals.
Right. So to think about it, medicine is a healing thing. The fact that we have medicalized mental health, even, that's a whole other discussion, because we're looking at mental health the same way we're looking at another disease, a physical disease that does require medication, that has a physical component to it that the medication will actually change. And mental health is a little more gray. Are we changing it? Are we not? How? And like I said earlier, we know it's different for different people. I know that from my professional experience.
Let's see, Dan Canoyer sends a super chat and says, given benzo prescription for anxiety as needed, used a few times for terrible panic attacks, got better, and haven't needed in several years. Helped me.
Yep.
Yeah.
That's a
It's
great
good.
use of it.
Yeah.
In moderation, I don't think it's wrong. And I'll self-disclose that I've taken benzos for the severe pain that I've been in, and it's helped me. Because the muscle relaxers didn't work for me, all those stupid antidepressants made me worse. They've given me every drug under the sun that made me crazy, amitriptyline, nortriptyline, all these drugs. These are, I'm not sure what they all are, but they're some kind of antipsychotic drugs, but they prescribe them for nerve pain, and they all have horrible side effects. And the only thing that really hasn't made me crazy is a little bit of Klonopin that I take here and there in small moderation. So yeah, I'm not against it 100%. I just think people need to recognize that it shouldn't be used without discretion.
This is something here too. Good. I put this on the screen a moment ago. Good Grief says, responding to the other listener who said that this was helpful for his son, says, I agree. I have a friend whose daughter died and SSRIs helped her extended grief issue so she could go to a job. And then continues on. I still think it's normal to be profoundly grieving after a child dies, though, but sadly we have to function too. And so this is something, if it actually does provide you some relief from things that are really hard, like truly, truly hard, like the grief of losing a child, if this is something that can help you to be able to put one foot in front of the other, then I don't see how that could be a bad thing. Although it's the idea that these are uncomplicated, simple solutions that don't bring with them a host of other effects. That's, I think, the real problem. When I was in counselor training, certainly we were not being trained to be prescribers, but we were given very little information about medications except that they were mostly pretty helpful and that you needed to know what diagnoses you'd basically be referring your patients out for prescriptions for. So we were given, if we gave the person the right diagnosis, they basically would just go to their primary care doctor and get the prescription. So it's almost as if you're prescribing. And we were given little information about it. You're given, I don't know enough. I don't know enough to hold a really intelligent conversation about this. I just know some surface things about it. But even with that, I have the training that I would need to be able to prescribe, or basically by proxy,
To recommend in a way.
by giving a diagnosis to your patient that they then take to their primary care doctor, who is going to hear, oh, your counselor said you need this. Okay, sure, here you go, and write that prescription. So it's prescription by proxy.
So primary care could write, like, I don't know, some antipsychotic medication or some, like, can they do that?
They
I don't
can.
know. Yeah, can they prescribe everything?
They
Primary
can.
care? Okay.
I don't think they do as often, but they can. I
Wow.
mean, I got stuff for my pain that would have been antipsychotic drugs from primary
Mhm.
doctors, and yeah, none of it helped me. It just made me cuckoo.
They pretty
So,
much all do antidepressants. Like, they're
mhm.
more reluctant to do the antipsychotics, which I think they should be. But pretty much any PCP will prescribe an antidepressant or, you know, a benzo if they think it's necessary. And I mean, in a way, it's a good thing because people are having terrible trouble getting in to see psychiatrists. You know, they might have to wait 2 months. The psychiatrists are so heavily booked. And if somebody's really, really miserable and suffering, I don't know that they could wait.
Yeah, I guess it depends on how severe the behaviors are, how severe the impact is on their life.
Yeah, yeah, exactly.
I also wanted to bring up a really fun topic. All of the school shooters have been on psychotropic
Mhm.
medications. That's
I've
something we
heard
don't talk
that.
about enough.
I've heard that.
Uh, I don't. The hypothesis is it does have an adverse effect on young adults and teens, where it can make them more suicidal and homicidal. It's written in the labels. Whether or not that's exactly what happened with each shooter, but that is something that is not talked enough when when those incidents happen. All they talk about are guns and gun control, and they don't talk about medication control.
Yeah, that's interesting. So has anybody validated that? Is that really true? Are all these incidences tied to psych meds?
Almost all of them,
Really?
I think so. Yes.
Hmm.
Yeah, but then that still doesn't tell you, is it some kind of ill effect of the psych med
Yeah, we
causing
don't
the
know.
violent behavior, or is it the symptoms of whatever they're diagnosed with itself? And
That's the thing. They don't
how
look
do
Mhm.
you
into it. We
know?
don't know. There's too
You
many
can't know.
variables. We don't
Yeah,
know.
there are too many.
Right, because they could have been have that mental illness that would have predisposed them to that behavior,
Yeah.
or it could be the medication that reinforced it or tripped it. We don't know. It's just one of those things that we don't look into. They don't talk about it, so that we will not know those answers. So it's all left as a question mark.
Well, it's really interesting. I wonder how much of this has to do with just the model, the medical model applied to mental health. How reasonable is that to think of mental health as something that you can prescribe or treat like a medical problem?
Yeah, I don't think it's a good one.
Where it seems like there should at least be more humility or expression of we're in territory we don't entirely know about at your own risk. Like, or this is what we do know, but this is what we really don't know, and hold that as opposed to people, this whole thing with experts, right? Like someone thinking, well, that's the psychiatrist, they're the expert and they know, that this is really good. So it may be a matter of given the unknowns, just some humility.
I really like
And
that word.
having it as an array and not maybe the first line of action unless someone is presenting, something so acute that telling you go change your diet is not going to fix it by tomorrow, you know.
Well, there's a lot of research coming out over the last, I guess, decade or so about how MTHFR variation correlates to an array of mental illness
What is that?
diagnoses. MTHR is methylene tetrahydrofolate reductase, and it's a gene sequence that does a number of things in the body. There's about and it would you can go and look this up if you want more information, or maybe I can pull some together if people want to talk about this at some point, because I think it's really interesting and relevant. But basically, it has some implications for how we excrete toxins from the body and some metals from the body. And people, there's about 40 to 60% of the population has some variation of this particular genetic sequence that limits their ability to excrete some toxins from their body, so they can end up with a buildup. The main implications are with regard to synthetic B vitamins. So people who have an MTHFR variation cannot utilize synthetic B vitamins, and they can end up not getting the benefit of B vitamins from their food or their supplements, but also they can block their pathways for methylation. So our food supply, our grains are enriched with synthetic B vitamins. The enriched grains are all synthetics, so it's just, they're enriched with synthetic Bs. So there's a lot of this in our food supply. Also, if you have an MTHFR variation, you're not going to be able to handle things like food dyes as well, artificial colors, things like this. And so over a lifetime, it can end up really impacting your body's ability to do some basic processes that can then create major problems for people. It's correlated with schizophrenia, bipolar, depression, and a range of things. And so the studies on this are really interesting. And when I was in graduate school, I was writing papers on this because I knew about this from my previous experiences with naturopathic medicine and my training in health coaching. And nobody knew about this. Nobody talks about this. People don't talk to their
I didn't know about it.
People
See,
don't
'cause
talk to people about how nutrition can impact you, even though we've made great strides in knowing about the interplay between genetics and environment. It's very slow to trickle through the medical community, and since, these are pseudo-medical fields, it's just very slow for people to recognize these things and start to implement them or make recommendations around them. But basically, it comes down to eat a clean diet. Don't eat a lot of processed foods. And this can really help. Some people are more sensitive than others, and it can really make a big difference.
Is that related to the methylation when they'll talk about over or under methylation? Is that the same thing, Leslie? Or
yes, methylation, homocysteine. It's I would have to bring some materials to read in order to make an intelligent case for this. But
okay.
I do encourage people to go out and read up on this. It's a lot of interesting material out there. Jennifer Atkins says, are y'all familiar with Dr. Stephanie Seneff? She does great work. I have heard of her, yes.
That name is familiar to me.
Yeah. And Good Grief says they're going to add B vitamins to processed food instead of making food healthier. Yeah, that's right.
Mm-hmm.
That's right.
I was just thinking also about legalizing marijuana and how much that has increased psychosis. I've seen this firsthand as a clinician. Many of the residential programs I worked at were young adults who, at the very least, didn't present with psychosis until they started heavily using marijuana. And then they became psychotic ongoing. It didn't go away. And not sure how much doctors, especially primary care doctors who are not doing follow-up, are looking at the combination of marijuana and whatever they're prescribing. So there's so many variables out there.
Mm-hmm. Well, this is a really interesting topic. I would be interested in speaking further with maybe getting if we have the opportunity to speak with someone who does know more about these medications and the pros and cons. So yeah, thanks for bringing it to us, Pamela. Is there anything that we should say before we wrap up? Anything we missed?
No, I like that, just ending with humility. I like when you brought up humility. We should all have some more humility, and we should recognize that experts don't always know things and hope that they have humility.
Yeah, absolutely. Well, thank you, everyone, so much for joining us, and I hope everybody has a wonderful week, and thank you, Pamela, for being here.
You're welcome.
Thank you.